Our symposium today is primarily regarding upper extremity throwing, baseball and softball. We have quite a few external speakers today joining us, so very excited to have everyone here. I'm just going to read a couple quick bios of the speakers from this first session, and then we will kick it off. Terry Phillips is joining us from Driveline. Terry graduated from Ithaca College with his doctorate of physical therapy in 2009. He then moved out to Seattle, where he began working in an outpatient orthopedic clinic. In 2016, he began working in a part-time capacity at Driveline Baseball in Kent. He moved into a full-time role in 2017. During his time there, he has evaluated over 2,000 individual baseball players. He has also authored several articles for the Driveline website. Devin Morgan is the director of youth baseball at Driveline and the founder of Driveline Academy. Devin started at Driveline in June of 2018 and started running the youth-focused programming for Driveline in 2019. He then created the youth baseball development certification course in January of 2020 to broaden the approach of developing skills at scale in youth baseball. To date, his course has more than 2,000 students enrolled. Devin then launched the Grow the Game free training sessions in the summer of 2020 with the intent of giving youth players who had lost a season of baseball due to COVID the chance to get back to playing in Driveline's state-of-the-art facility with more than 400 players participating. Most recently, Devin launched the Driveline Academy team program, which had over 100 players across 8 teams in year 1 and currently has more than 210 players across 17 teams in year 2. Devin was born and raised in Seattle and currently resides in Shoreline, Washington with his wife and 2 children. And Dr. Oliver is a full professor in the School of Kinesiology and director of Sports Medicine and Movement Laboratory at Auburn University. She received her PhD from Texas Women's University in biomechanics. She's a fellow of the American College of Sports Medicine, a certified athletic trainer, and a corrective exercise specialist. She is an active member of the American College of Sports Medicine, National Athletic Training Association, National Strength and Conditioning Association, the American Society of Biomechanics, International Society of Biomechanics, International Shoulder Group, and executive board member, Pediatric Research in Sports Medicine, and American Baseball Biomechanics Society. She's the president-elect for the American Baseball Biomechanics Society and on the executive board of the International Society of Biomechanics in Sports. Her primary research focus is on injury prevention and performance enhancement in youth baseball and softball athletes. Dr. Oliver has published over 150 peer-reviewed manuscripts and performed over 400 presentations both nationally and internationally. Among her peers, she is known as the expert in not only youth baseball and softball injury prevention, but also the biomechanics of windmill softball pitching. Thank you all for being here. And Terry and Devin, if you'd like to kick us off.
All right. Can everyone hear me pretty well?
Yes, we can.
Okay, awesome. Give me 1 second here.
Here,
all right, so my name is Terry Phillips. I'm the head physical therapist at Driveline Baseball down in Kent. And today, or this morning, Devin and myself are going to be talking about basically Driveline Academy's approach to working with youth athletes as far as trying to develop them into good ball players, but also trying to keep them healthy. And first and foremost, I want to thank everyone for having Devin, myself, and actually Kyle on the panel as well. Seattle Children's is obviously a really prestigious hospital, and to be asked to be a part of a symposium is definitely a privilege in itself. All right, so quick introduction about myself. As Tara stated before, I'm a physical therapist. I grew up playing baseball. I pitched into junior college, where I actually was unfortunate, maybe actually fortunate enough to receive 2 labrum repairs. You kind of put the pieces together as to how I got into physical therapy from that. After my baseball career is over, I graduated at Ithaca College, where I received my doctorate of physical therapy in 2009. Shortly after, I moved out to Seattle, started working at Olympic Physical Therapy in Kirkland. I was there from 2010, 2017. Worked with a lot of patients all over the board, but definitely a lot of youth athletes. 2016, I started working at Driveline in a limited capacity, just 1 day a week. And then finally, in 2017, I moved there full time. Full disclaimer, I have a 2-week-old at home. So if I'm, rambling or incoherent, it's because I'm running on a quarter tank of gas right now, and I apologize. And I'll let Devin go through his introduction when we get a chance. Or do you want to go through it right now, Devin?
I mean, we can just do like the 30-second version. It's basically already covered. The story of my history at Driveline, the story of my baseball history is I got run out of the game kind of by bad coaches right around when I was 17. Had kids, decided I really didn't know anything, tried to learn as much as possible as a youth baseball coach. Started coaching in Little League a little more than a decade ago, and I've had the privilege to coach not only my own kids, but a bunch of other kids in that time. And then Driveline has kind of given me the opportunity to really lean into what I think is needed in terms of kind of an emotionally considerate and developmentally progressive environment for youth baseball that kind of like capitalizes on the fact that it's a real low consequence environment where best case, worst case is we just want to keep kids enjoying the game, loving baseball, wanting to continue to play baseball, and also specifically for the purposes of this talk, staying healthy.
All right, so I'm going to just start off with just a few principles that we feel are important to just baseball players in general. First and foremost, I think we'll all be in agreement with this, is that too much stress can lead to injury. This is going to be both relative to the athlete and something that's also adaptable, though. So, for instance, let's say I could squat 250 pounds. If I attempted to squat 300 pounds, 300 pounds would be too much stress for my body. I would very, very likely, if not definitely, get injured. However, over time, I could train that. I could work on getting stronger. I could work on my technique. I could build more resilience in my body. And eventually, I get to the point where squatting 300 pounds would be fine. And I just essentially improved my body's ability to handle that amount of stress. Second, stress is going to be a product of power. If we take an example, we'll switch sports here and kind of take an example of like an Olympic long jumper. As they're running up to the line to like jump into their sand pit, that last push they have into the ground to basically propel themselves forward shows an immense amount of power, and also with that, a lot of stress expressed through their ankle, through their knee, through their hip, and through the muscles of their leg. And again, whereas if like any of us were to take on that amount of stress in our legs, we would very likely be injured. But for like Olympic long jumpers, they've been trained for their whole lives. They have their training dialed into the point where they can withstand high levels of stress without being injured while also expressing high levels of power. And then finally, power and therefore also stress is necessary for progression in baseball. If we take major league, any major league level player, regardless of like how good they are, they were very likely the best, if not one of the top 2 or 3 best players in their college team. Every college player was one of the, 1 or 2 best players on their high school team. Every high school player was probably best players growing up in Little League. So we do need, for an athlete to be able to move up to the next level, they need to be able to express more power, more output as far as like throwing harder, hitting the ball harder, running faster than what their peers at that level will be able to express. So now we have basically like 2 opposing thoughts of one, stress, of being too much stress being injurious, but also we need stress to progress to the next level. So then how do we reconcile this? Driveline, we take a full like integrative approach where we utilize skill coaches as far as throwing, hitting coaches, high performance coaches on the strength conditioning side, physical therapists, whether that's myself or Jordan, our Driveline Academy PT, and it's all integrated into like one training system. And kind of our big pillars that we focus on are going to be mechanics, which I put in quotations here because we definitely do it from a different perspective of what is traditionally taught. And again, Devin is going to get more into details of these. I'm just going to kind of hit on the pillars here. We also work on athletic development, essentially just building the best possible athletes that we can be, so they can just take on a lot of different stresses, a lot of different forces. We're also going to monitor their workload. And by workload, I just mean not only the amount of throws they do within the context of a game, but how many throws they're doing in practice, how many high intent throws are they doing relative to like what they're capable of. And we're going to get a bit more objective of monitoring that as opposed to what you get out of your traditional pitch counts. And then finally, we're going to go with exposure. And you can take this through numerous ways, whether it's exposure of throwing in variety of games, not like competitive games, but like just games within practice, using weighted balls, which I'm going to talk about here in a second, or using various constraint drills, so that the athlete has essentially like been exposed to a variety of stimuluses that when they get into a game where they see like chaos can reign free, that they are not subject to anything they haven't been subject to in practice or in their own training. So I'm going to dive into some of the research on weighted balls. This is definitely, still a hot topic for debate, and I think weighted baseballs still kind of get treated almost like the boogeyman of sorts. When actually they've been around, they've definitely been more popularized in the last 3, 4, 5 years, but they've been around since the 60s or 70s. Here's a systematic review done by Duren's group in 2009 that basically looked at various studies using mostly high school, college athletes, some youth athletes, looking at utilizing overload balls, heavier balls, underload balls, lighter balls, or just a combination of two. And every study found that there's a significant increase in velocity. So whether or not weighted balls are effective as to improving velocity or improving performance for an athlete is basically just not up for debate at this point. Like I said, it's definitely been proven that they are helpful. But like I said, it's only useful if we can do so in a manner that is not injurious to athletes. Second slide I want to talk about is going to be this article by Glenn Fleissig from 2017, where basically they look at the biomechanics of various weighted ball throws, both off the mound and off flat ground. In this case, flat ground should be noted that it was done like the quote unquote run and gun or crow hop or just run up and throw the ball as hard as you can variety. So when people take this study and they say, oh, well, flat ground weighted ball throws have more stress than mound throws, it's really just because like in this specific study that they were running up and throwing the ball harder. And previous studies have shown that anytime any athlete that throws a baseball harder, the harder an athlete throws a baseball, the higher their stresses are going to be. Specifically with this, with the weighted balls, what they found with the 4 and 5 ounce and the 5 ounce being like the regulation size baseball is that both the kinematics, mean like essentially the joint velocities and how fast the body is moving, and then the kinetics, essentially like your torques, your stresses on the shoulder and the elbow, were essentially the same with the 4 and 5 ounce. Again, they were a little bit higher with the run and gun throws because there was higher velocity. But then what they found as there was the balls got heavier with the 6 ounce and 7 ounce is that both the kinematics and the kinetics both decreased, whereas the 7 ounce essentially had like the lowest joint velocities and stresses. But let's talk about these two studies. These are probably the two biggest studies, especially of recent memory, where people point to and be like, yeah, well, weighted balls are bad. We have these studies that show this. They're both done by Mike Reynolds' group. One was essentially a 6-week program that they had athletes do. Another one was they're just looking at the acute effects of weighted baseballs and what happens on shoulder range of motion for them. So for the 6-week study, Mike Reynolds' group took a group of like middle school and high school students, athletes, I should say, during their off season, broke them up into a control group and an experimental group. The control group essentially performed only a general 5 ounce throwing program. It should be noted that in the study that what the 5 ounce throwing program is not well stated. It's just kind of a vague statement of they just did a generalized throwing program. So it's really hard to glean information as to like what actual effect or training effect they were getting out of this. So, I mean, we got to take that with a grain of salt. But then with the experimental group, essentially what they did was they had those kids also do the 5 ounce throwing program the control group was doing, but then they also had them do a group of like 3 different weight ball drills with a variety of weights and have them do it 3 times a week, increase in intensity as the 6 weeks went on. And what they found was that, yes, the weighted ball group gained velocity more so than the control group, but there was also a 24% injury rate. Additionally, there was an increase in external rotation range of motion, as well as a decrease in shoulder abduction strength. So again, just looking at this from the surface, you see the results, and you see, yeah, the weighted ball group, they got more, they were injured more, they had bad things happen to their shoulder, so therefore we shouldn't use weighted balls. But just like anything else, any good condition, you need to get into the methods and kind of see the details of this study. So when we look at this, we see a lot of different extraneous variables that were potentially having an impact on the outcomes of this study. First and foremost was just the increased volume of throwing that was done in the experimental group. And when you actually add it up, it was a total of 510 extra throws that these middle schoolers and high schoolers were doing within the course of 6 weeks, comparison to the control group. And again, in comparison to just our gym, our highest level throwers, our college athletes, our professional guys, 510 throws is an extra week of throwing. If we're going down to like our middle school and high school guys, 510 throws is an extra 2.5 weeks of throwing that was basically like condensed into a 6-week program. So you have the control group that's doing their 6 weeks of throwing with just 5 ounce. Then you have the experimental group, was essentially combining 8.5 weeks of throwing into the 6-week program. And as everyone here will agree with, like the number one contributor to injuries in any sport, let alone baseball, is just going to be overuse. So to do like basically put this amount of volume on a throwing athlete in their off season is already kind of a recipe for disaster in my opinion. Second thing we look at too is that their high intensity throwing started in week 2. They said it was 90%, but 90% roughly is like game-like intensity. And then by week 3, they were throwing at max intensity. Again, for comparison, we don't want any of our athletes to come in driveline, whether it's a youth athlete, a well-trained athlete. We want them ramping up for a good 4 to 6 weeks before we even let them start throwing at like some competitive level. So again, you're taking these like athletes, they're in their off season, they haven't been doing much throwing, and then week 2, like, okay, start throwing game intensities. Additionally, they're having to do this 3 times a week. And eventually they get to a point where they're throwing max intensity 3 times a week, in addition to this control, the controlled 5 ounce program. And again, comparison in our gym with our competitive, our most competitive athletes, the college pro guys, we don't have those athletes do quote unquote velocity days. We're throwing max intensity more than twice a week. We have found that any more than that, you're really just starting to mess with the athlete's ability to recover from the workout. And then you're essentially just going to drive that athlete into the ground. And keep in mind, this is what we're finding with our highest level athletes who are well-trained, who have a lot of like throwing fitness, who are strong, who are mobile. And we don't feel they can recover. And now, again, you're taking untrained middle school, high school athletes, and you're having them do back, and essentially you're treating them like a major league reliever, and you're expecting them to not get, run into the ground with this. It becomes like pretty irresponsible in our opinion. And finally, the last thing was just that there was a large dispersion of ball weight. Again, if you're going back to athletes who just have no history of weighted balls, there is still something to be said about like, kind of like easing them into it, for lack of a better term, where like, if they're most used to the 5 ounce, you don't all of a sudden, expose them to the 2-pound ball and say, okay, go throw at max intensity. While we do have our athletes get up to like heavier ball weights, it is over a period of build-up time. And we also say, okay, we're not doing this at max intensity. This is just like a warm-up to kind of get your arm loose. Whereas with this study, it was just like, okay, here's every ball weight under the sun, throw them all as hard as you can, do it 3 times a week in addition to all the extra throwing that you're doing. And then when injuries happen, we're going to blame the tool that we use as opposed to our own application of the tool. So again, like I said, yes, the experimental group was more injured, but just like anything else, it goes back to the application of any tool, not just the tool itself. Next study was their acute effects on shoulder range motion. And this was fairly similar, where they basically took, they took weighted ball drills. They had different ball weights. They had them do 3 throws at each weight in each drill. Again, it was performed at max intensity. They broke up each group into an underload group, an overload group, and an extreme overload group. Underload group was like 5 ounce and a little bit lighter. Overload group was 5 ounce, a little bit heavier. Extreme overload group was just like your heaviest weights. And again, your 1-2 pound weights. They came in like once a week. They measured the range of motion before and after, and they said, okay, let it rip during these drills, throw them as hard as you can. And again, this was also during the off season. What they found with the underload group was that there was no increase in shoulder external rotation. With the slight overload group, there was a little bit of an increase in shoulder external rotation. And with the extreme overload group, there was a larger increase, about 8.4 degrees. So then this commonly gets pointed to as like, okay, basically the point that is jumped to is like, oh, well, this is how weighted balls work, is that they just increase shoulder external rotation. So, that's what increases velocity. Which, like, if you just look at within the context of this study, yeah, like I guess. But again, this is not something that anyone who has actual experience with like utilizing them as far as programming would actually program this way. Again, not going into like the heaviest balls and throwing at max intensity, not doing it without having been properly on ramped. And then, like I said, just giving the athletes more chance to be built up to this. So, for comparison, we're going to look at what Driveline did as far as our own peer-reviewed study back in 2018, where we had a 6-week study where we used our college athletes. They came in at the beginning of the summer. We did a motion capture analysis on them, and then did some table tests. And then after 6 weeks, we retested in the motion capture lab, retested on table tests, and just saw some various things. Some notable findings from our own study was, one, there was no significant increase in velocity. And what this can oftentimes get pointed to is like, oh, well, this means Driveline doesn't work. There was no significant increase in velocity in this 6-week period. And my argument is like, that's actually a good thing. We do not want to see significant increase in velocity in a short period of time. And let's say there was a significant increase. Let's say it was even just like 2 miles an hour, 2 miles an hour, 6 weeks. And then they're getting like, let's say they keep that pace, 4 miles an hour in 12 weeks. Then we extrapolate it to 24, 52 weeks. You keep on doing that, and over time, that's just a large amount of velocity. And as we talked about before, that's a large amount of additional stress that the body needs to get used to. And when you're adding that much additional stress in a short period of time, that's when your injuries can happen. So we think that it's actually a good thing that you did not see a significant increase in velocity. And again, that's not a knock on us. I think that just like shows like how well we utilize our training routines. Additionally, from a biomechanical perspective, they found that shoulder abduction and external rotation were lower at ball release. Again, whether that's better or worse for throwing, you could make an argument for or against. But basically what that shows is that in a short period of time, with how we quote unquote, coach mechanics, which is minimal cueing, and just doing various constraint drills, which we'll definitely talk about, we were still able to make changes in a way the athlete throws. So, yes, we didn't see the changes in velocity, but we did see changes in the athlete's quote unquote mechanics. Additionally, we also saw that there was an increase in shoulder passive range of motion for internal rotation on both the dominant and non-dominant arms. So one, this wasn't just that they, weighted balls are increasing shoulder internal rotation range of motion, which is also bad. It just shows that when you're utilizing weighted balls, let me back up though. For those that aren't aware, like shoulder internal rotation is kind of like a big one that gets pointed to as, this is something that happens to throwers over the course of the season, is that both immediately after throwing, as the season goes on, they lose shoulder internal rotation range of motion. And we found that, like I said, doing our training program, doing our weightlifting, doing our soft tissue work, following up with the physical therapist, that the shoulder rotation on both sides actually increase. So we can essentially mitigate some of the effects that you would traditionally see throughout the course of the season when you're doing a well-rounded program. And then finally, when we broke up the two groups between guys that gained velocity and guys that did not gain velocity, neither groups had significant increases in both passive shoulder external rotation, which as we just talked about, kind of more corresponds with it being a well-rounded program where we're not just taking guys, having them come in and just be like, okay, huck these weighted balls as hard as you can, and then good luck. They're utilized like comprehensively as part of a good overall program. We also saw that there was no max external rotation increase during the throwing motion. So essentially that max layback did not increase whether they gained velocity or not gained velocity. And finally, which I think is one of the most important aspects, is that both valgus and shoulder internal rotation torque did not increase, whether again they got gain velo or not gain velo. So again, I think this goes back to like weighted balls when they're used poorly. Yeah, that's injurious. But I mean, I think a 5-ounce ball, when it's used poorly, is injurious. And I think that has been shown over the last 20 years of the amount of throwing injuries going up. But just like anything else, use a 5-ounce ball appropriately, use a weighted ball appropriately within a well-comprehensive program that attacks a lot of various things, that you do see the positive effects that you want while also still like maintaining a good level of health. I'm going to kick it over to Devin now. He's going to get a little more into the details.
All right, thank you guys for having me. First of all, and Terry, thanks for kind of setting the table from the PT side of things and also just, breaking in the studies. I think that stuff really sets just kind of a fundamental baseline of understanding that we can start to understand why and how we've constructed our academy program the way that we have. And the first thing, just relative to the player populations, I think we really need to have a firm grasp of the fact that just like young players, and to be specific, I am actually going to extend that definition.
Devin?
Yeah.
Can everyone see? I still have it up on my screen. Can people still see my screen with Devin talking?
Yep.
Okay.
Yep.
All right, cool. So I'm going to run through the
Yeah.
slides as Devin talks.
Yeah, you got it. Thanks, Terry. We just really want to establish that young players are a very specific class of player, principally because they're not small adults. Young players present to us with various amounts of strength deficits, motor control and coordination deficits, and obviously throughout the course of our time with an average youth athlete, if we do our job and we keep that kid wanting to play baseball, they're going to go through different growth phases and also the real specific peak height velocity phases that are just going to affect the way that they play the game and specifically their mechanics therein. There's just going to be a real significant impact on movement and mechanics. Terry, you can go ahead. Simultaneously to this, I think as parents and coaches, and oftentimes parents who coach, we have a real strong desire for what we interpret to be good mechanics, not necessarily the good-looking mechanic on the left-hand side of the screen, but oftentimes kind of what we do on the right-hand side of the screen, which is we kind of just take a two-dimensional picture of a real high-level athlete and just kind of throw this like word salad at them about everything we think is either good or bad of that athlete, some of which has just as much impact as the old hidden dragon on our slide here. But the attraction of this, the mechanical panacea, I think is really significant because we infer that there's going to be both performance and health benefit if we can kind of get any athlete, but specifically a youth athlete, to that place. Because again, we're primarily talking about parents, oftentimes are the ones that are coaching these youth athletes. And we have like an actual biological relationship to one, if not more, of the players on the field. I don't have that type of relationship with my Los Angeles Dodgers. You go to an average youth tournament and you're seeing that relation all over the place, which I think drives some of what, in terms of intention, actually comes from a good place about this kind of focus on mechanics. Terry, you can go ahead. And to get all the way into the weeds, specifically with the background of, I think, what Terry already established, I think it's important to understand that just that the mechanics that you're going to see from the average youth player, whether that's hitting or throwing, are very much the result of the system. This is what they bring to the table is kind of a system of strength and movement, coordination, range of motion, et cetera, and they're trying to execute a movement. This particular GIF on the screen is my son going through motion capture over the course of about 2 years at Driveline. There is, I believe, like an 11-mile-an-hour velocity difference between him when he started all the way on the left and him when he started motion capture in June of 2020 all the way on the right. And you can look specifically in the yellow skeleton, the difference just in the real significant amounts of horizontal shoulder abduction, which have allowed him to throw harder. That change in mechanic is very much just kind of a process of adaptation over time, and not anything that we actively cued in terms of, this is a more mechanically ideal position, please do that. Go ahead, Terry. And the result of that, the reason for that, again, is just that youth players are defined by their strengths and weaknesses. With our academy athletes, we put them through a very simple strength assessment. And one of the pieces of the strength assessment that you can actually kind of see different player populations, compare them against each other, is just a counter movement jump. So we have them perform a counter movement jump on a force plate system. And you can just see that even if you kind of differentiate the 9 through 12-year-old population, and then the 13 and up kids, it's very, very significantly different. And then if you even take those 3 groups, essentially the 15-year-olds all the way down to 9, and then compare them broadly against the 16, 17, and 18-year-old athletes, we're very much kind of in a potato-tomato situation. These two things are not the same. Go ahead, Terry. To get a little bit more specific, you know, again, the reason for why we don't do a ton of kind of mechanical cueing is being really aware that these young players are going to go through these different phases of growth and also the specific peak height velocity phases that really just affect their ability to control their bodies. The analogy that I typically give with this is that my daughter's 15 right now, and she is learning how to drive, and it's terrifying. That said, if I put her behind the controls of a Volkswagen Beetle, I would feel reasonably confident that she could probably perform that task, because the Beetle has meager power output, meager size, really easy to control, easy to execute controls. Putting her behind the controls of a monster truck, very different. Huge differences in dimension, huge difference in power output, and much more complicated controls. And I think about that when I see kids that kind of go through these big growth phases, and all of a sudden just their ability to kind of coordinate this full body proximal to distal throwing motion just kind of goes out the window. Terry, you can go ahead into the next one. And it's not due to lack of effort. You know, with these young athletes, coordination and proprioception are very much developing skills. If you ask these kids, specifically like the 12, 13 and unders, to sign their name 10 times, much like our friend Jasmine here, you're probably going to get 10 different signatures. And it's not due to lack of effort or an attempt to coordinate motor control. It's just kind of where they are biologically right now. Go ahead. But simultaneously, again, we have this intention that comes from a good place about wanting them to have good mechanics. And effectively, a lot of times what happens is we put these kids in training environments that focus on mechanics, which is very much not ideal because the majority of them rely on a system of internal cues. And, you know, when I do slides and presentations and stuff like this, I try to generally avoid the wall of text. This one, I kind of want to lean into it just because there is enough research that's been in the ecosystem for a very long time that's kind of pointed to why this type of internal cueing, and again, to be really specific, when we're talking about internal cues, we're talking to athletes about very specific positions, the way that they internally configure their bodies as part of some sort of sport-specific skill. You know, when you go to an average youth baseball game, you're going to see moms and dads and coaches, you know, yell at kids to get the back elbow up or keep the head still or do such and such with the feet. This is all kind of different types of internal cueing, and all of it tends to be not great in terms of kind of the net effect that's in studies in athletes. Terry, go ahead. Instead of that, what we try to do with our academy initiative and just kind of generally our approach to training youth athletes is put them in environments where there are very, very clear intentions for what the outcome of this is supposed to be. And I would generally posit that an ideal outcome for any thrower should be to throw the ball hard, throw the ball accurately, and try to repeat that as much as possible, again, in consideration of where they are biologically and their ability to kind of perfectly repeat these two things. For me as a coach, I would much more rather have consistency about intention rather than hanging my hopes on consistency of mechanics. So this is just an example of a drill that we did in our old driveline facility. This is my daughter when she was 13. Again, it's a real clear intention for a training environment. We want you to hit the target, and in order to do that, you're going to be able to throw the ball hard and ideally throw the ball accurately. Terry, go ahead. So when we talk about things like this idea behind skills at scale, I think the easiest way to kind of conceptualize this is just we're trying to establish a new form of communication between coaches and athletes and between coaches, athletes, and parents about what is good and about the way that we're kind of trying to quantify and contextualize both performance in youth baseball and also kind of what all of this means. On that path, we really want to just kind of incentivize individual development. We want to leverage this idea that if we can essentially execute a test and retest model and communicate that to athletes and parents, we're trying to drive engagement the same way that we would academically by having them understand that they're actually improving in a sport-specific skill. And as it pertains to kind of the way that that resolves itself on a field, we're just not going to have our youth baseball experience defined by the outcome. Nor are we going to define our athletes by a very ill-suited and hard to pin down definition of what is good mechanics, again, both relative to just the biological reality of youth athletes, but also understanding that all of us are kind of our own, you know, biological snowflakes. And we understand this in the Northwest. You know, Tim Lincecum grew up around here. Couple Golden Spikes in college, a couple Cy Youngs and some World Series rings. I don't think that most people would say that he had a bad career, but he has really, really unusual mechanics in terms of the amount of contralateral tilt that he had in throwing motion. It's not something that you would typically prescribe to a kid, but I typically think about it from a standpoint of knowing that his parents had to take him places to throw in front of coaches, and how many times he was probably coaches attempt to coach him out of a movement solution that was very much relative to him at an individual biological level, and obviously allowed him to perform at a really elite level. Go ahead, Terry. Again, within this framework, this kind of using this idea of skills at scale as a way to communicate context of our youth sport experience, data is going to be the language that we speak, and it's really important to, again, you know, we're going to reference some motion data we have in motion capture. You know, we have a really well-built R&D machine at Driveline. You can communicate in this language using high-level data, or also just things that we can observe with a piece of paper and a pen. You know, that game that we showed with my daughter throwing at the plate in the air, that's a game that you can have kids play. You can just score it and then communicate that score. And again, we're just trying to have them understand through both kind of concepts of gamification and also understanding improvement, driving engagement, helping them know they're getting better at the game of baseball. Go ahead. A huge portion of our approach to developing throwing athletes is just this consistent, every single day that we're going to throw, meat and potatoes approach to arm care. And arm care is kind of a broad term that we use that really means that we're doing a lot of things specifically. We're going to utilize some overload underload principles, again, throwing both balls that are lighter than a standard 5-ounce baseball, which, just to be very specific, was not kind of decreed upon by On High as the only safe you know, baseball implement throwing weight. We're going to take advantage of some overload principles to try to drive movement efficiency. We're going to take advantage of some underload principles to try to drive movement speed. We're going to do that kind of in a framework of constraint positions to kind of break down different phases of throwing motion into smaller specific component parts. We're going to execute that on a schedule, and we are going to moderate intensity and volume while we stick to that schedule. And I would offer that this is almost the direct opposite of what was executed through the Reinhold study, where the schedule was greatly accelerated and the volume and intensity of throwing was greatly accelerated, and then kids got hurt, and it's not hard to know why. So this just GIF on the right-hand side is my son when he was probably, I think, 11, essentially going through this different phases of that arm care program, starting with J-bands, moving into wrist weights, and then the Plyocare overload underload balls. There you go ahead. And again, when we start to think about things like throwing velocity as kind of the metric that oftentimes we're going to think about when it comes to skills at scale, we want to see kids throwing harder. I think a lot of times when kids gain velocity, sometimes there's this pushback by people that think that that should be an issue of concern. The tricky thing here is that velocity really is an expression of things that I think we generally believe to be good, right? It's going to be an expression of strength, obviously, both within the arm specifically, and also throughout the entire athletic ecosystem when we're trying to execute this big proximal to distal kinetic sequence. Again, velocity is an expression of the efficiency of that sequence, and it's also an expression of both the athlete's energy and also fatigue. So if we pay attention to things like velocity, we understand kind of what a baseline for that is, and we start to see velocity coming off the table. That is a great indication using a system of feedback to know that that athlete is tired, and we can start to, again, make some considerations not only about training, but also in-game usage. The fact of the matter is there just aren't enough weighted baseballs that are sold to explain kind of the rash of injuries we've seen lately with youth throwers over the last decade, which I truly believe that indicates that kind of the biggest contributor to this is the way that we, again, don't significantly monitor or limit throwing volume, both in the acute and the chronic sense for young athletes when they're playing games. Terry, go ahead. The other way that you can kind of establish and get into the weeds here about understanding what we call workload, right, is this measurement of the difference between the acute volume of throws on kind of any given day, and then kind of the chronic volume of throws over a rolling window of time. We use what used to be called Modus, and we bought Modus and now Driveline Plus, essentially like a pedometer for the throwing arm. We can start to establish what that workload looks like over time and also monitor throw count, because what we want to see is kind of on this graph, this kind of gradual build up of that kind of chronic workload, and then maintaining that over time as we get into season. Very next one. And this enables our coaches to start making differences, or start making decisions about, again, game usage that's informed by the data they're taking in. You know, essentially, if we collect better data on the health of our throwers relative to workload and their throw counts, we can start to make better decisions. One huge thing that's involved here, again, when you're talking about youth athletes, is that they're all essentially what we call two-way players, where you're going to have kids that both pitch and they also catch, and they play shortstop and they play third base and they play center field. If we don't consider the sum total of all of those throws, and all we're looking at is something like MLB PitchMart, you know, MLB PitchMart is a great initiative, and I think it's made a ton of valuable difference with the leagues who are effectively mandating usage of it. So you're talking about Little League and Pony League. Unfortunately, not a lot of tournaments pay any attention to mandating MLB PitchMart compliance with their organizations that participate on the travel or the tournament side. And then additionally, MLB PitchMart is, again, just a very binary metric. You were either under or over their prescribed numbers of throws. And if all you do is kind of pay attention to that binary number, you miss something like what we're able to get through Driveline Pulse, which is, again, just kind of this longitudinal picture of what our workload looks like. Go ahead. So to get a little bit more athlete specific, we can kind of get closer to wrapping up here. You know, again, motion capture, because we have the luxury of having our own R&D lab, is a system that we can put our Driveline Academy athletes through. We have them do 2 throwing motion capture sessions per year. One after we've concluded, again, you know, a 4 to 6 week onboard, and then another one at the end of the year to, again, just kind of quantify the way that our throwing has developed over that period of time. What we want to see is, of course, an increase in velocity, ideally, but we also want to see increase in movement quality as these young athletes are just kind of developing and learning how to use their bodies better. So one of these athletes is a kid named Callum Shulberg, who gained effectively 13.6 miles an hour over the course of about a 13-month program when we started the academy. Callum started with us actually as a 12-year-old. When we had youth training but not youth teams. We have biomech on him on the throwing side from when he was 12. And you can see kind of on the graph here, this is just a velocity aging curve, what we've established with athletes in our gym. So normative range is a throwing velocity dependent on age. When he was 12, he was kind of about an average 12-year-old. He was playing for a different organization, same when he was 13. When he was 14, he started with us in our teams because he had launched the Academy Team Program. And then retested again in November of this year and was up effectively, you know, a little more than 13 miles an hour in that period of time. You can go to the next one. And he's been able to gain that performance by increasing movement quality. And we can also, again, see how that movement quality has impacted, you know, the stress that he's putting on his body. The amount of hip to shoulder separation that he got was increased pre to post sample. The amount of shoulder horizontal abduction obviously changed pretty significantly, but he had a relatively small amount of increase of varus torque on the elbow. This is kind of normalized for body weight because, again, we have this huge sample of athletes from, you know, professional kids that throw 100 miles an hour plus all the way to 9-year-olds that throw like 35. Go ahead and go to the next one. I also just wanted to kind of touch on the value of this type of programming and why we take this really specific focus on, again, increasing throwing performance as very much a necessary thing that kids need to be able to do if they're going to continue in this game. Generally around the ages of 13 or 14, kids move from a youth size field to, you know, what we call a full baseball field, a 60-foot mound, 90-foot bases. That progression in play space essentially goes from about a 45,000 square foot play space to a 105,000 square foot play space. It's like a 262% increase just in the dimensions of the field, which is really, really significant, and also I think broadly under indexed for. And the thing that we know is we lose, you know, the Aspen Institute has studied this, and on average we lose about 2 million kids per year in that progression from 6 to 12 to 13 to 18. And I truly believe a contributing factor there of kids stopping playing baseball at that period of time is that they're just underdeveloped for what is very much a necessity when you have this real significant change in play space. So John Morrison was a kid that started our program when he was 11. He was very, very, very behind the normative velocity aging curve for a kid his age. He gained 11.3 miles an hour in the first year of our program. And we've gotten him closer to, again, kind of where the normative kind of range of performance for his age. I have no illusions that that kid is going to go play college or professional baseball, but what I do want to do is safely equip him with the tools that he needs to just continue to play baseball at a high school level if that's something he actually wants to do. You go to the next one, and you can actually see John, gained a little bit differently. Again, some fairly significant increases in hip-shoulder separation. John was a very inefficient thrower when he started with us. So in a pre-post sample, he actually reduced the amount of torque that he was putting on his body simply because he was throwing more efficiently. By throwing more efficiently, he was able to throw harder, and essentially the velocity that he gained per unit of internal rotation torque drastically increased. Again, there's no mechanical panacea as far as I'm aware where you can throw 100 miles an hour and just put zero stress on your body. I think stress is good because stress, again, as Terry hit it just right at the beginning of this thing, stress is going to be expression of force. So the question is how do we adequately prepare kids to essentially accumulate stress in a positive fashion over time and acclimate to that type of necessary force production in a way that is safe and healthy. And that's all I got.
Devin and Terry, thank you so much. We appreciate it. We're going to hold questions until after Dr. Oliver's talk, but if anyone has them, please make sure to drop them in the chat or write them down. I will share my screen. And Dr. Oliver, you should be able to kick us off.
Perfect. Thank you, Terry and Devin. That was a great presentation. And I think mine just builds on it in that we're trying to get in on the front end of some of the things that we're seeing in our baseball and softball throwers. So if you could advance the slide, please. I wanted to, Tar, if you could advance the slide.
Brian, sorry.
Oh, perfect. Tell you a little bit about the Sports Medicine and Movement Lab at Auburn University, in that it was when I established the lab in 2013, it was very important for us to know who we were. And that really seems like a simplistic question sometimes, but I know I've gotten many questions about how to develop a lab, how to develop a research lab, etc. And I have a background as an athletic trainer, so I have a sports medicine background and biomechanics background. So overall, you could say, okay, we have a movement lab, because so then I took a step back and said, no, what is the purpose? What is our end goal? And it's basically what's being done in my lab is injury prevention and performance enhancement in baseball and softball athletes. So yeah, we could look at injury prevention and performance enhancement in anything being at a university and having this type of lab, but I wanted us to be known for one specific thing. So what we do is we bring in youth, mostly youth, and then we get a lot of college athletes in. But the cool thing about this lab is that we have established a database, and nothing to the level of driveline as in like the level of thrower, but more with your typical just, okay, what youth are out there playing that parents maybe think they're going to go somewhere, or the parents are buying in and saying, oh yes, we want to further the research to help the sport. We want our kids to stay healthy and to be able to play the game. So since 2013, we have brought in mostly youth, and like I said, now we have more college coming in. Baseball and softball athletes. And for everyone that comes in, we're doing full body analysis. So if they're a pitcher, they're throwing 3 of each of their pitches. If they're a catcher, they're throwing down to second. I'm fortunate because I do have a 120-foot throwing lab. We're also looking at their lumbopelvic hip complex stability, because we're seeing effects of that in not only injury susceptibility, but in performance. And we're also looking at hitting. So we're doing all these things where that allows us to collaborate. That allows us to collaborate with those who are training the athletes. That allows us to collaborate with the athletes on the field, the coaches, the orthos, the PTs, and when they have that scientific question, or when you have that as a sports medicine professional, that question, like, wonder what about this or what about that? Because like, wonder about that flexed elbow, or wonder about that if arm length that we've looked at is a non-modifiable risk factor. And with all of these athletes that we're bringing in, we're also looking at their pain history. Okay, you can advance to the next slide, please. And I say pain history because I realize that it's hard to get individuals in who are actually, back up one, please. They look very similar, that they have an injury. So if you're dealing with youth, they're not going to be able to come in if they have an injury. If you have the collegiate, the coach isn't going to let them come in if they have an injury. So we started really looking at their pain, their current pain and their pain history to say, okay, we cannot say because of the pain, but we can start developing some models, some systems that say, okay, these things are in common with those who have upper extremity pain. This picture here shows more of our field-based testing. So we also try to go out. We have a remote facility where they do private lessons and stuff, and we do some basic field testing out there to hopefully get the coaches and the trainers to realize that there are some measures that they can be doing on the field, that they don't have to be in a lab to have the high-tech, high-end equipment to incorporate some of our injury prevention strategies. So that's, in a nutshell, our lab. We're collecting most days of the week on the youth, and it all goes towards the research. And so for the rest of this presentation, I wanted to just highlight some of our latest papers that we've done to more so get your wheels spinning and say, okay, yeah, there does need to be more research in the throwing athlete. I've done a lot with pediatric research in sports medicine, and it seems like the comfortable area is the lower extremity, the knee, the ACL, and that's not my focus. Okay. So yes, I know that there still needs to be tons of research there. My focus is on throwing, and I can state for a fact that we don't have enough throwing research. The more information that we have, that we can collect, that Driveline can have, that then when Driveline implements their programs, the better off we're going to be, the more positive outcomes we're going to have. So some of our studies that we've had ongoing, next slide, we're starting to look at energy flow. And if you are interested in these studies, they're all on my Google Scholar, or feel free to email me, goliver@auburn.edu. Because the energy flow, when we're looking at the body as a system, then we know it's connected chain as a system. Oftentimes we may just look at segmental velocities. But in this study, we actually looked at, okay, what is the energy? How are we transferring the energy? And previously, when we looked at energy flow, it was more of, okay, just in general energy flow. But if you break down energy flow, you've got absorption, transfer, and generation. So you could have great energy flow through the trunk and onto the upper arm, but is it truly all being transferred, like the energy out of the trunk? It's going out of the trunk, but is it truly being transferred, or am I having to generate the energy again in the arm? So with this study, this was one of the first to look at energy flow, specifically transfer in youth baseball. And we had about 40 youth baseball around the age of 15. And really, we want to quantify it. And the shoulder and the elbow, what we found were they were primary transfers of energy. And specifically, distally, they transferred energy prior to ball release. And then they had a more proximal transfer of energy after ball release. So if you're saying distal, it's more of the shoulder, and the proximal is going to be more of the elbow. We also saw energy absorption at the elbow during the acceleration phase, and then energy absorption at the shoulder during the deceleration phase, which also, it just reiterates some of our the things that we've previously seen and associated with some injury. And then that the pitch speed was affected by the energy transfer. So it's like, how efficient are we able to transfer that energy? We may not see a difference in mechanics immediately when they start to fatigue, but do we see a difference in that energy transfer? So I think with this, we're starting to look at energy flow, because I think it gives us another layer of, as you say, the onion of what we can really find out and look at some injury susceptibility things. Next slide. We also looked at a common measure, and you saw it on the previous presentation where they were measuring like range of motion and strength. We always look at range of motion and strength of the glenohumeral joint. And with this one, we also looked at youth. We had about 78 youth, and we wanted to see, okay, instead of the range of motion, we know there's some stuff with GERD on range of motion, but what about their isometric strength? So just using a handheld dynamometer, if we looked at their internal and external rotation isometric strength, is that related to their shoulder internal rotational torque during the pitching motion? So the part of the pitching motion that we really examined was the acceleration phase and maximal external rotation. And what we found was, so we took them all of those 78 and we said, okay, what's the mean of this group? Because there's youth, and you can look at normative data, but just within the group we had of 78, what was the mean strength for internal rotation? What was the mean strength for external rotation? And then we said, okay, those that are at or above, and then those are at or those that are below the mean strength. And what we found was that those that were below the mean strength on external rotation, they actually had greater internal rotational torque during their pitching. So that's something that we look at. And it goes to show that, yes, when we're looking at training, we do need to continue to address that external rotational strength. Okay, next slide. This is one that has been accepted, it's not yet out. And this is where we looked at drive leg kinematics during the wind up and push off, because of the relationship we know of having a stable base. So we're always looking at lumbo. I look a lot at lumbo pelvic hip joint stability, because if we don't have the stability, we're not going to be as efficient in transferring the energy from the lower half to the upper half. And you see this a lot in kids where they end up looking like, and typically they are throwing with their arm. And I also see this where either they can control their body down the mound or they seem to fall down the mound. And what we found was in the windup, how stable were they? Did they display that knee valgus when they did the high knee windup? And those that actually displayed the knee valgus, they also had increased elbow forces throughout the pitch. So again, we have, there are some studies out there looking at measures of lumbopelvic hip complex stability, such as a single leg squat and performance during the pitch. Well, we want to see if within the pitch, are they stable when they're in their windup? And basically those that were not as stable, they ended up having greater elbow forces. And when you normalize it to the ball speed, because we know that the harder you throw, you're going to have greater forces, ball speed was negated. And so it really went down to those that were more unstable, they had the greater forces. Next slide. We also wanted, this is one of your docs, Dr. Saper, we looked at some anthros. So we looked at upper arm length and forearm length and loading. And we did find that, yes, that your upper arm to forearm length ratio does play a role in your elbow varus torque. And that would be one of your non-modifiable that, okay, we cannot help that. We have to work, though, within the system which was talked about previously, and working within the system. What we also found, though, was the loading rate. And the loading rate was actually related to an increase in the elbow forces. So if we can do things to mitigate that loading rate, have a slower loading rate, then maybe we can mitigate some of those forces. But I do think it's important that we can definitely tease out what variables are actually modifiable and what variables are not modifiable, and that we are looking at it as a system, because there's more than one thing that's contributing here. And so you look at all these studies and you may say, okay, external rotational strength, or we have loading rate and all these things, but it's not just one. We have to look at more from a systems point of view. And the last three, the next slide, please. We're also doing a lot with softball. When I talk about throwing athletes and representative in the literature, softball is vastly underrepresented. And I always say it's sad when most of the literature is coming out of my lab, because I shouldn't be producing the most literature on softball. We need more people looking into it, because the huge misnomer is that, oh, it's a more natural. No, they're throwing and they have the same forces. It's just at a different point. And I could lecture for hours on throwing is throwing is throwing. When you look at the basic physics of throwing, it's all the same. And when it comes down to it, it's just an arm slot. So no PT, no ortho, nothing. You shouldn't be worried about, oh, they're a softball pitcher. I don't work with softball pitchers. Well, do you work with throwers? You should be able. We're not in our field. If it's more sports medicine, injury prevention, we're not teaching them to pitch. We're trying to get their body to be the most efficient so they can pitch. So when a lot of PTs will call me and ask for stuff on softball, and I was like, well, have you rehabbed to baseball? And they say, yeah. I said, okay, then why do you think it should be different? You focus on where their pain is and what arc of motion they're having the pain, but a lot of it's the lower extremity. So we've looked at the association of upper extremity pain and softball pitching, and what we found is it is lower extremity. It's that stride length. They're overstriding those with pain. Their trunk kinematics are altered. So it's the timing of their trunk. Some of them are more rotated still towards the pitching arm side. And then it's also their center of mass. Once they stride out, a big thing with softball, they think they want to leap out so that they can get closer for release. Okay, but they need to be able to reposition their body so that they can use the front side. They don't have a mound to help them. I often have them throw off a mound or throw on a hill to get them where they have to use their front side or they're going to topple over. But a lot of the things we see with upper extremity pain is the lower half not in sync. And because of that, then what are we doing with the energy flow? We're having to make up. Next slide, please. This also goes on to where we looked at, this one is in for review, softball pitching energy flow and performance. We had more in this with upper extremity pain. These were collegiate athletes. And I think with this one, we had about 20 to 30 in there. With this one, we did not see a lot of difference. So in the previous group where I looked at upper extremity pain and performance, or in their mechanics, we saw differences. And it was college. These college, we did not see differences in the energy flow. We did not break the energy flow up into absorption and generation, though. But it also makes you think, okay, do they alter their mechanics to make up or to compensate? So in this area, when we start to see differences in mechanics with those with pain, that just tells me we need a greater database and to bring more kids in to really see if we can splice it out. Okay, and I think I have one more maybe slide. And then again, I mentioned in the lab, we're also doing hitting. Hitting is something, and I know Driveline's also getting into hitting. And I cannot reiterate more. The questions that you have, hitting, the literature is very scarce. And with hitting, we're looking at the segment power analysis, which is, again, energy flow. And this was more of a descriptive study. A lot of our energy flow and power analysis stuff this past year was more descriptive in nature. so that now we can say, okay, those that are doing certain things, or those that have upper extremity pain, or those that have restrictions in their hip, how is their energy flow effective and their hitting performance? So I'm not sure if I have one more slide. I think I do. Next slide. Okay. These last two slides really are about the lab. We try to give back. I know Driveline is more where they come and they train. I don't have the training, but we do try to give back to the athletes. We try to show them, okay, here's your numbers. Here are the normatives. However, we're not shooting for just a number, but the parents want to know, okay, where are you ranked? It works great, especially when we talk about the hip, because they're always restricted in the hip. And we can show them, like, look, we got to really work on hip mobility. We also try to give them a little bit of education, and we give them some free throwing exercises. And we try to be a service to the community, to the throwing community, because at the end of the day, we want all the athletes playing the game that they love. So if from my side, we can find things in the data to put it out there so that training programs can alter or improve so that we can keep the kids playing, they can keep increasing their velocity and not putting themselves at risk, then overall that's the goal. And I'm going to stop there because I think we have a few case studies that we want as a panel to present.
Wonderful. Thank you so much, Dr. Oliver. I will stop sharing my screen. And Steve, if you kind of want to monitor and if there are a couple things to go over with the panel.
All right, can you guys all hear me?
Yes.
All right, so if you have questions, please feel free to put them in the chat box. I'll be looking at that, but thank you guys for your information. A lot of good stuff there. So as we wait for some questions, I got a couple things we might start off with that I think a lot of us as PTs will see in the clinic when a patient comes in is injured. Can you guys comment about the inverted W? Is it bad?
Barry?
No, I don't actually think that. Yeah, I got that echo. Steve, are you able to? There we go. Okay. I mean, no. It's not like the, probably the most efficient way of throwing. But again, going back to, like, is it definitively injurious? I don't. The research behind that is just not there. Yeah, it might, like I said, it might put more stresses. But again, a lot of, like, the notoriety is from guys like Mark Pryor in the past and, like, just various studies. But again, that's also just, like, it's a small piece of the puzzle too. Yeah, a guy might have an inverted W, but he might also be, like, dialed in with every single other part of, like, what we talked about as far as his, his workload monitoring, his strength training, the usage of his, of his throws. So it's just a small piece of the puzzle where there's, on the flip side of things, you have guys who have, like, perfect mechanics, but they don't weight train. They don't moderate their throwing intensity well. And they're more likely to probably get injured. So in regards to just, like, the inverted W itself, I don't find that that's, like, a huge issue.
I'll follow up on that because that's something that I'm asked a lot too. And it's individualized because some can do it. And it depends on that individual's mechanics and then what is their training load. So if I were to really monitor them and look at how efficient they are with that energy transfer and stuff and know that they can only throw X amount and they stay within their workload, then that can be okay. Maybe that's the quirk that allows them to have so much movement. So that's what we have to be careful on, like it was mentioned. Okay, what are the perfect mechanics? Well, there's way more that goes into it versus looking at, okay, at maximum external rotation, this is where we need to be, et cetera. So it is a red, you'll say a red flag, or I'll say it's a flag that you want to make note of, but then you need to make sure you're looking at other things as well.
Great, thank you. We've got a question coming in from Elise, kind of geared towards the driveline guys. Does the weight of the ball change with age? And kind of a secondary question, what is your guys' philosophy or considerations when working with pre and post-pubescent athletes?
So the ball weight definitely changes. To get a little bit more specific, when it comes to training modalities for like our average 14U on down players, we don't have them do any leather weighted baseball throwing. So what they're throwing is what we call the Plyocare Balls. So it's like a soft sand-filled ball. You know, people from Tom House all the way down, you know, have been using this type of training modality for a very long time. So yes, the ball weight definitely does change. And to get a little bit more specific, you know, we have an adult Plyocare ball set that includes a 2,000 gram, 4.4 pound ball. We don't have basically any of our kids, again, I don't know, I would probably say like almost 17 on down, use that. And the reason for that is also, I think, a little bit indicative of the way that we modify weights at an individual level. When we're training athletes, one of the benefits of having a teams initiative through the academy is that we have control. You know, we have athletes for the duration of a year, and essentially over that course of time, because we're going to give kind of this process of movement adaptation some space to work. We can really monitor for technical proficiency when it comes to the constraint drills we're having athletes perform in. Keep them at a ball weight that is appropriately overloaded, where we're going to be able to see an expression of movement adaptation over time, but not movement adaptation that is like defined by like a crippling amount of ball weight. So effectively what our coaches do is essentially just monitor for the technical proficiency when they're executing drills, and aren't going to graduate them into a higher ball weight until they can actually perform in a technically proficient manner as much as they can, again, relative to just the general biological consideration. In terms of pre and post pubescent athletes, you know, we don't want kids that are not younger than 9 to do really any type of structured training. I broadly think the kids that age should just play. They should engage with the game the way that they want. You know, they're going to do a decent amount of just kind of moderating their own play volume, just because if they're given that freedom. So generally the kids that are younger than 9, we don't have in any type of structured training. When it comes to the post-pubescent athletes, so you're talking about, you know, when you start to get into high school ages and things, again, the philosophy is that with those kids, we start to get, say, 15, 16, and 17, because, again, their ability to coordinate and proprioceptive development is definitely improved from the average 9 through 12-year-olds. We might give them some amount of internal cueing if necessary, to, again, help them understand how their bodies move better, because if I'm giving an internal cue to an athlete that's like 16, 17, or 18, I'm less concerned about what's been established in research, which is that a lot of times when kids orient for movement accuracy, they're taking motor output off the table. And what we really want them to do more than anything else is just understand and learn how to sprint by sprinting. Again, utilizing constraint drills, utilizing overload, underload principles, and having them learn how to use their own bodies as efficiently and as effectively as possible. So there's definitely some pivot points there for sure, both in terms of the way that we coach and also the way that we program.
Great, thank you. Question from Abby coming in. How much time off, particularly for youth athletes, are you guys recommending in a year? And also, are you recommending any participation in more than one sport?
So in terms of time off, I'll kind of do the quick outline of kind of the way that we execute our year in the academy. We actually start off-season training in October, which I think is a period of time where broadly a lot of people are either not playing baseball at all, or they're actually still trying to play games on like a fall ball or a winter ball thing. We're going to start our off-season program in October, but that's going to start with, again, you know, probably a 4 to 6 week onboard, where it's a very gradual acclimation to both returning to throw and also increasing intensity and volume over that period of time. So we're going to do our off-season program from October through February. At that point, when it comes to our 12 and under Little League eligible, rec baseball eligible kids, and also our high school athletes, we essentially go dark on them while they're doing that stuff. We don't want them to try to do a bunch of high intensity training simultaneously to practicing with their high school baseball team 6 days a week. You know, that's just, again, a bad mix when it comes to volume and intensity of work. So we will essentially, with those kids, get them back around sometime between May and June. We will play the majority of kind of our tournament games in that period of time from June to July, possibly the front part of August. But in my world, I would really like to be shut down for all of August and all of September. So we want to probably take at least those 8 weeks off. But then again, we have another 4 weeks on the backside of that where it's a very gradual return to throw program. So if you look at something like MLB Pitch Smart, I believe they recommend somewhere between 3 to 4 months off of throwing per year, depending on the age of the athlete. So in total, we're probably a little bit shy of what MLB Pitch Smart recommends, but again, we're bundling that with some phases of training and again, a really considerate increase in the intensity of throwing, because again, the intention of what we want to try to do is when we start playing games in February, and these kids go into their Little League programs, they start playing games in March, we want them to essentially have acclimated to the point where the stresses that they're going to have in game is something that is not new to them. It's something they've already kind of, again, gradually and safely acclimated their way into. So yeah, we're probably in total time off. We're probably somewhere between, 8 to 12 weeks. And again, there's also some individual athletic considerations in there as well. Kids who have had a high workload, we might shut them down for longer. Quickly about the thing about recommending participation in more than one sport. This is like a 40-minute to an hour-long conversation to dig into. I think the short answer is that yes, we broadly want athletes to be able to play different sports because different sports teaches them to solve different problems. And I truly believe that a lot of those kind of non-baseball solutions you need to solve are going to inform and develop your ability to perform baseball tasks in a positive way. You think about a sport like soccer or basketball that's much more kinetic than baseball. If you have a kid that's a really good soccer athlete, I would bet that kid is probably a pretty proficient shortstop or center fielder. The issue with this stuff, a lot of times when it comes to multi-sport participation, is time. And it's both a time thing for parents to be able to juggle. And I say that as a dad who's had a kid at one point of the year where we had our soccer season was starting, our soccer season was ending, basketball was starting, and we were doing off-season baseball stuff. It's a lot to manage. It's a lot to manage for the individual athlete side because, again, these kids are young and resilient, but they're not bulletproof. And it's also just a lot to manage in terms of just schedule and I think just emotional burnout. So yeah, you have to, I think you really, really want multi-sport athletes because of the benefit there. I think the trick is sometimes, well, if my kid really, really loves to play baseball, how do I keep them playing baseball but develop them not in a solely sports-specific fashion? And part of the reason for us in the academy, we have such a tight integration between our high-performance department, our R&D department, our physical therapist, Terry and Jordan, is I have families that just all their kid wants to do is play baseball. I don't want to set that kid up to be like the best 12-year-old in the world that has no shot at being competitive once they land on a 90-foot field. So we spend a lot of time and energy putting it into just kind of holistic athletic development. That sometimes means we have less time to do things like first and thirds or PFPs if anybody wants to get a little bit more specific in kind of the sum effect of this, which is that like you might have less time to game theory optimal your approach to winning a 12-year-old game if you spend a half hour of your practice putting kids in like a long-term athletic development program of movements where they're going to produce force and accept force and change direction and jump and stop and skip and fall. You have to make some choices there. And I think a lot of times that kind of comes back to the core value of what the people at the top of the program are communicating about the things that they value to parents. So yes, we do want multi-sport athletes, but beyond that, we want holistically developed athletes who can play baseball. And it's just kind of a question of like, how do you do that? And how do you accommodate the schedule to get there? Sorry, I feel like that was a lot, but.
No, that's great. Dr. Oliver, do you have anything to add to that?
I totally agree. I'm the big proponent of, I want them to be able to move athletically. That's the biggest thing. When they get stuck in just doing one thing, we lose out on some of their just basic athletic movement, and playing different sports allows for that.
Yeah, I mean, if you look at kids, if you look at kids in throwing motion where their lead leg is inefficient at blocking, right? That's going to lead to all sorts of just like energy loss and inefficiency in the sequence. Well, how do you train a lead leg, right? You train the lead leg, and you train the lead leg to be more effective at bracing and again sending that energy impulse up the chain by both putting it positions where you're going to like maybe do that in a sport specific way, and you also could just have a kid jump and land, like. But you typically, if you look at like an average, 12-year-old Little League practice, you're not going to see a lot of that. So again, a lot of times, we can talk about wanting multi-sport athletes, but the question, I think, just kind of then moves its way up the chain to the people at the top who are making decisions about how are we training with kids? Are we really just kind of specifically just going baseball skill? Or do we consider, or does anybody even understand that you can train that kid more holistically in terms of athletic development and see some eventual sport-specific payoff?
Great, thank you. And Dr. Saper commented, as you guys talked about, the limitation of the time off guidelines is the lack of gradual progression back into throwing. People come in and say, well, I took 2 months off and then jumped literally back 100 miles an hour, pun intended, to throwing, and then are surprised that they have an injury. So that gradual progression is certainly well needed. There was a similar question from Janine, which I think we pretty well covered in terms of family, parent, and education about specializing in sports as they are doing younger, earlier year-round play with multiple teams. So we're definitely wanting people to participate in other sports, to learn other movements.